Hello. Today we are going to be talking about a topic that is less familiar or less common. This topic is none other than andropause. Andropause is basically what we often call the male menopause. The root of the word is essentially a pause or a cessation of androgens. Androgens are male sexual hormones. Andropause is characterized by decreased testosterone levels associated with the normal aging process. The effects of male hormonal imbalance can be devastating, with significant effect on how men look, how they feel, and how they even perform. The onset of these symptoms is gradual and can be vague, and often accompanied by mood and attitude changes. Because of this, they may be missed by some men, or they may be disregarded as a form of depression. Some common signs of andropause include a lack of energy, decreased physical strength and endurance, declining physical coordination and agility on some men, and a loss of libido. There is also decreased sexual performance and erectile dysfunction, which is the most common. I believe a lot of men have experienced this issue of erectile dysfunction. We also see a decrease in ambition, in work performance, and we see weight gain, especially what we call abdominal fat, or this is the fat that is around the belly, or what we call a pot belly in some men. We have often emphasized very much that men should keep a lean muscle mass, or they should stay physically active for the best benefit of testosterone in their bodies. We also see blood sugar elevation or increased insulin resistance. Some men become moody and they have depressed feelings, and some become irritable, and there's anxiety, and there's loss of stress tolerance. There are increased aches and pains in the bodies of some people. This includes pains in the joints and other areas. For some, there is diffuse sweating and hot flashes. And yes, with andropause also there is an issue of hot flashes. I know this is also always associated with females, but it happens in males as well. There is cognitive decline, which is memory loss and loss of concentration. There is also restlessness and insomnia. And there's a loss of self-esteem above everything else, and an altered state of well-being. And there's dermatological changes, that is loose skin or wrinkling, because this comes with aging. There are a couple of factors that influence the decline of testosterone. As a part of the normal aging process, the body produces declining levels of testosterone after the mid-20s. The testosterone decline is affected by multiple factors, including your genetics, your nutrition, your lifestyle, the levels of stress, alcohol intake, cigarette or tobacco smoking, trauma, obesity, and some medications that are given as prescriptions also affect men in this instance. There's also an issue of infections in the body and a heavy toxic load. Our environment nowadays exposes us to motor vehicle fumes, to industrial fumes, and other gases and chemicals that are released from industrial produce. We also have toxins that are in our food because our food is sprayed and stuff like that. So this exerts a lot of pressure on the body, and there's heavy load of toxins. Some of this may be lead, cadmium, and mercury. So these also cause a testosterone decline in our bodies. The exact nature of each man's symptoms, as well as the age of onset, is highly variable. You cannot put a date or an age to a man to say they will start experiencing these symptoms at a certain age. Therefore, it is very important that men are generally aware of what might be happening to them, or the changes that they might see when such starts to happen. Testosterone generally has many physiological benefits, including enhancement of libido. Testosterone is the make or break of a man. It is what makes a man a man. It helps also increase in lean body mass. Generally, men with good testosterone have got good body mass, and it helps to maintain strong bones. It decreases the risk of heart diseases, and it lowers the LDL cholesterol, and it decreases insulin resistance. As men age, the delicate balance between testosterone and estrogen may lead in favor of estrogen production. A relative high level of estrogen in the male may decrease the level of the luteinizing hormone and therefore decrease testosterone production. For all males out there, there's a small amount of estrogen in their blood, just like all females have got a small amount of testosterone in their blood. It is not ideal, therefore, that estrogen should be the overcoming hormone in the body of a man. When that happens, testosterone production is affected, it goes down. Both men and women have about a small amount, just a small ratio. For testosterone, young men have an average of 50. Both men and women have a specific ratio of testosterone to estradiol or estrogen. Young men have an average ratio of 50 to 1. The ratio drops with age as low as 8 to 1 in normal aging. The average 60-year-old male person has more circulating estrogen in his bloodstream than the average 60-year-old female, which is not good. This is what causes a testosterone decline. The conversion of testosterone to estrogen takes place under the influence of an enzyme called aromatase. Testosterone can convert to estrogen, but DHT does not. There is evidence that prostate health also is related to the balance between the levels of estrogen and DHT. Therefore, a man with even normal levels of testosterone but with increased estrogen may in effect be andropausal due to the inhibiting effects of estrogen. So you see, with more estrogen in the body, there comes inhibiting effects, like it inhibits the production of testosterone, so therefore testosterone goes down. These are some of the common causes of elevated estrogen in men. Number one factor is obesity. This leads to very high estrogen levels in both males and females, and the adipose tissue, which contains aromatase, it results in higher conversion of testosterone to estrogen. Therefore, obesity remains a disadvantage to men as far as testosterone is concerned. Obesity lowers testosterone levels in all age ranges. It is not an issue of a person is very old. It cuts across, so it cuts across all age ranges. Some of these things that affect the body negatively, pharmaceutical drugs. They may cause a blockage, like they block testosterone production, or they accelerate the effects of aromatase, the enzyme that causes a decline in production. One example of such pharmaceutical drugs is a diuretic called Lasix. These are some of the innocent medications that one might be getting to treat certain diseases in the body, and their effect becomes negative in this case. These drugs, they cause a loss of zinc stores in the body, and consequently reduce testosterone production. Now we come to a very, very important mineral in the body called zinc. Zinc is essential for testosterone production. We have often said to our men that they must eat seeds. They must eat watermelon seeds, pumpkin seeds, sesame seeds, and other different types of seeds. This is because these seeds contain good amounts of zinc, and every man needs zinc for the production of testosterone. A zinc deficiency reduces the pituitary's release of the luteinizing and the follicle stimulating hormones. These are necessary for the stimulation of the Leydig cells for testosterone production. So zinc also helps to inhibit aromatase. So every man basically needs good amounts of zinc for them to have healthy testosterone levels in their bodies. Another thing is stress and other psychological factors. They have a negative effect on testosterone production and metabolism. One other thing that is very, very important to note is liver function. If a man has got a poor liver function, then there are certain things that happen in the body that leads to testosterone production decline. A healthy liver is essential for elimination of toxins and the production and repair of all body systems. This includes hormones, connective tissue, and the organs themselves. And an overburdened liver or a diminished liver function can ultimately lead to altered endocrine balance. We spoke earlier on about issues of the environment, where we inhale fumes, toxins from the air, from industries, from cars and stuff like that. When these, it means that they are not properly assimilated in the body, and there is toxin overload leading to altered endocrine balance. Another enemy here that we see, which causes an elevation in estrogen, is alcohol consumption. Aside from the obvious stress that alcohol causes to the liver, there is what we also say prolonged alcohol abuse is associated with higher levels of body estrogen. Alcohol decreases zinc levels in the body of men. So heavy drinkers of alcohol often exhibit related symptoms of gynecomastia and testicular atrophy. Gynecomastia is what we call male boobs, or a man who has breasts slightly bigger than normal, than they should be for a man. So we see these exhibited in people who abuse alcohol or heavy alcohol drinkers. We also have an issue of insulin resistance. Altered sugar metabolism and elevated blood sugar can lead to obesity and a lot of other issues or effects on body hormonal balance and altered tissue repair and organ dysfunction. Therefore, it is very, very essential that the men should be aware of these enemies that cause an elevated estrogen levels in their bodies, and also that men should be able to open up and communicate the signs that they see in their bodies, because testosterone effects or altered testosterone levels can be altered back to normal with assistance. There are a couple of things that can be done, that is altering one's diet, giving herbal medication from a naturopathic point of view, and physical activity, that is physical exercise, and balancing one's stress or learning how to manage one's stress, and also certain supplements like zinc and stuff like that that a person can take to manage this problem. So I therefore urge our men to be aware of the symptoms and all those things that are undesirable that causes the estrogen levels to go up, and to take action about it while there's still time. There's also what we call a testosterone replacement therapy that one can get from any other doctor out there. So there is always something that can be done to assist a man. Some of the effects of having a low level of testosterone in the body of a man include low generation of red blood cells in the bone marrow and osteogenesis. So prolonged diminished levels of testosterone may therefore result in osteoporosis and potential anemia in men. Other significant long-term effects include frailty due to lean body mass, obesity, and abdominal fat accumulation. It also increases the risk of cardiovascular diseases. It increases erectile dysfunction and emotional depression. Therefore, we care about our men, and we hope they can care about themselves as well. We hope they can do something about their health. Your health is in your hands and not in anybody else's hands. I wish this message would reach somebody and help somebody. Thank you very much for taking time to listen. Stay safe and stay healthy. Bye.